Although many studies report increased risks in pregnancies in women over the age 35, there's nothing magic about the number 35. Risks for preeclampsia, gestational diabetes, and preterm delivery increase with age, and more important is the state of a woman's health prior to pregnancy and during the pregnancy. For example, a woman with high blood pressure should be on medication and have her blood pressure well controlled prior to becoming pregnant in order to decrease her risks in the pregnancy. The risks of developing preeclampsia in a pregnancy increases with increasing age. Preeclampsia is a condition unique to pregnancy in which women develop high blood pressure and protein in the urine. And sometimes this can also happen very early in the pregnancy, leading to a preterm delivery. So gestational diabetes is diabetes that occurs during a pregnancy. It does go away after the pregnancy. However, that woman is at an increased risk to develop diabetes in later life, as well as gestational diabetes in future pregnancies. In general, as a woman gets older, there is a higher chance of needing a C-section, only because all of the other pregnancy complications do tend to increase, such as preeclampsia and gestational diabetes, growth restrictions, so therefore the risk of needing a C-section increases. With increasing age, there's also a slight increase in the incidence of placenta previa, which is a condition where the placenta covers the opening to the cervix. So if you think of the uterus as a big water balloon with the cervix being where the balloon is tied, the placenta previa is a condition where the placenta is right there where the balloon is tied. Because of the location of the placenta, a vaginal delivery isn't possible because the baby would be going through the placenta, and therefore a C-section is required. Placenta previa is easily diagnosed by ultrasound, and so it's almost always known during the pregnancy, and therefore the C-section can be planned, and the woman knows to report any bleeding as soon as possible to her physician. Older women are also at risk for having smaller babies, which can also lead to long-term health problems for the babies. Although we don't know the exact mechanisms how this happens, it's thought to relate to the deficiency of nutrients from the placenta during the pregnancy. The most important thing for any woman to do prior to becoming pregnant is to optimize her health. In other words, try to obtain an ideal body weight, eat a healthy diet, control any medical problems, and also just educate yourself about the different screening and diagnostic tests so that you know which one is right for you.